Hello, and welcome to CaseyCast, the Annie E. Casey Foundation's podcast, where we explore how to create a brighter future for children, youth, and families. I'm your host, Lisa Lawson. Today, we're diving into how public systems can better serve young people and communities. Our guest is Alex Briscoe. He's a principal at the Public Works Alliance. He has decades of experience designing and leading transformative public health initiatives. He's championed using Medicaid to drive systemic change and is a leader in innovative workforce programs like EMS Corps. EMS Corps trains young adults, many with child welfare or juvenile justice system involvement, to become emergency medical technicians. By combining training, mentorship, and support, EMS Corps creates career pathways while empowering participants to serve their communities. Alex, I'm so thrilled to have you. Welcome to CaseyCast.
Thank you, Lisa. It's really nice to be here.
Why don't we start by just sort of talking about your work? It often connects health, education, and social systems. And uniquely, you use Medicaid as a tool. So could you talk a bit about your work, what drew you to Medicaid as a tool for transformation and how it sort of led you to this innovative EMS Core program?
I wish it was a romantic story. It's a deeply practical one. Medicaid is where the money is. And it's the essential financier of safety net systems. In California, Medicaid is a $140 billion program. I learned my Medicaid making payroll, Lisa. Like, I was trying to keep clinics open and ambulances running and hospitals from shutting down.
So your experience really grew out of running a public health program, a hospital system.
Yeah.
Wow.
Medicaid is the tie that binds child-serving systems. So when you think about the juvenile justice system or the foster care system or the public education system or the early childhood system, you will find that in every one of these systems, Medicaid has a footprint. From paying for special ed, for paying for home visiting, for paying for wraparound supports, for paying for residential care. To change these systems requires money and influence. And Medicaid provides both of those.
That's great. Thank you so much for helping people understand the role financing can play in system change. We always hear follow the money. Tell us what you understood, how the financing worked. What then inspired you to think of, well, how can I be creative with this? What led you to EMS Court?
I was a therapist in the Oakland Public Schools. I worked in juvenile detention and foster care, in sexual assault units, in really high acuity settings. And then for 12 years, the last 8 of which I led one of the state's largest health systems. I was appointed in 2008 when we had a horrible financial crisis, which really constrained the revenues of big systems. And so I had to keep things open and make things work. And one important one to think about was our juvenile hall. We had like 486 kids in there, which is way, way too many. And our probation department couldn't afford to staff the thing. So, I mean, part of this is luck, right?
Right.
And so we were able to say to our partners in public safety, hey, we got all kinds of opportunities. All these young people are low income. All of them qualify for Medicaid. How about these? And we reduced the population in juvenile hall from 486 to 34. And the same thing in foster care. We had 6,600 children. And we got that down to 1,200. The primary funder of those system changes was community-based mental health services funded by Medicaid.
You are very passionate and talk a lot about mental health.
Yeah. I mean, this is a uniquely difficult time to be young in America. Before the pandemic, we saw a doubling of inpatient admissions for self-injury. Like twice as many kids hurt themselves so bad that they had to be admitted to the hospital. And then the pandemic poured gasoline on that fire. And we got to this unfortunate place where suicide leapfrogged cancer as a cause of death, where 42% of young people report persistent feelings of sadness and hopelessness. Like, I really believe this is the issue of our time. And because Medicaid covers half of all children in the nation, any solution at scale requires we get that part right.
Right.
So,
right.
like, I met you, Lisa, at the White House, where I was talking about these changes we've been making in Medicaid to try to make it more relevant and effective. And one of those is the workforce. And my beliefs in this space are really born of my experience. I've seen a lot of human suffering And so I think those of us who've done this work for a long time really know that there's a beauty and a wisdom and intelligence in this struggle that low-income folks have.
Mm.
And that's not only a personal quality, it is likely the solution to our system's challenges.
Mm.
So when we flip our frame and see the people we serve as essential actors, then it leads you to, wait, who's eligible to bill for Medicaid? What are those rates? What do they have to do?
Mm. So really trying to change who could be paid for their services.
But one of the essential changes we made was create new types of providers in Medicaid, like community health workers, like doulas, like
Mm.
wellness coaches, like certified peers.
Interesting.
Not only is that like an economic justice issue, like most of the people I serve needed a good job more than they needed a therapist.
Right.
So
Right.
there's a truth of that.
Mhm.
But it also is a delivery system reform and quality issue for the healthcare system.
Mm.
Because we know when your treating professional shares your lived experience, outcomes are always better.
Mm.
And then we also in mental health have a fundamental workforce shortage.
We do. I think there's anyone listening who's ever tried to get mental health care, especially today for a senior, a young person, an adult, and hasn't faced the inability to find a provider with any availability.
So it's an economic justice issue. It's a
Mhm.
delivery system reform and quality and access issue. That's why EMS Corps is so important. So we were running a very busy 911 system, 150,000 calls a year,
Mm.
one of the busiest in California, and a good one. But we had trouble staffing our rigs.
And
Like
when you say a rig, what's a rig?
an ambulance.
An ambulance.
Yeah,
Okay.
yeah. So we're having trouble with our staffing. And so we decided to train a handful of young people to be EMTs, and we did everything possible wrong.
What's
Like,
it take to train an EMS
so
technician?
it's the same test across the country. It's called the National Registry.
Okay.
And you need a high school diploma in 180 hours. And we trained our first handful of young people, and like about half of them got rearrested.
Oh no.
Yeah. And we asked, we're like, yo, what did we do wrong? And they were like, you didn't pay us. You didn't guarantee us a job. The people who trained us didn't look like us.
Mm.
You didn't help us with the things we really needed help with.
Mm.
So we dug in, which and that's why when I tell the story, I really want to make sure folks understand, like,
You listened.
yeah, listen careful and persist.
Mhm.
So 12 years later, across 3 sites, 2 in California and 1 in Albuquerque, we've trained over 600 young people.
Mm.
And what we did was take the program from 6 weeks to 6 months. Young people needed longer. So we wanted to give them the chance to bond as a group and prepare for entry into a workforce which is dominated by really good people.
Uh-huh. And so how old were these young people? Are they over 18?
Yeah, 18 to 26. You have to have a
Okay.
high school diploma.
Yep.
And there's certain offenses that disqualify you. So we do
Sure.
a background check and blah, blah, blah. But we decided early on that 180 hours wasn't enough. So we changed our curriculum and made it 480 hours.
Ah. Mm-hmm.
And we added a $1,500 a month stipend.
Mm-hmm.
And
So they'd
uniform.
have some stability
Yeah.
while they're in the program. We hear that from young people all the time. Like our basic needs are the foundation for us to do other things. It's lovely that you're planning all these programs for us, but if we don't know where we're going to sleep, if we don't know how we're going to eat, we can't participate and certainly can't focus. So yes,
Yeah.
great.
And then
solution.
the third leg of that stool, if you think, stipend, enhanced training,
Mm-hmm.
and a bunch of mentorship and experiential learning,
Mm-hmm.
and then comprehensive wraparound supports.
Mm-hmm.
And by wraparound, we mean things like formal mental health care, healing circles, care coordination and case management, cognitive behavioral training.
All things that really help them heal from the experiences that they'd had prior to this.
So yes, full stop. And young people who've overcome things, big things, make incredible superheroes.
I think that's one of the most beautiful things I've ever heard you say. That's wonderful.
EMS is not for everybody. All right.
Mhm. What is the work?
I mean, you're going to everything from a senior falling down to a mental health call to a sprained ankle to a trauma on the freeway to a gunshot. A young person in one of our interviews says, you're with people at one of the worst moments in their life.
Mm-hmm.
And the compassion and the care you show them, he says it's a gift to provide.
It is.
Like, opened him up to purpose and empathy. But let's just get really practical for a second. EMS systems across the nation face a crippling staffing shortage.
What's behind the crisis?
We're competing with Starbucks at entry, 18 to 24 bucks an hour kind of stuff. It's not for everybody. Like, and sometimes you don't know until you try it. And it's physical labor, and you are in and around real human suffering. And the key thing about EMT, there's about a 30% turnover annually. You don't stay in EMT long, and this is both the blessing and the curse. If you persist for 3 years, you become a paramedic, and the systems you work in pay you to do that, and you can make $100,000.
Oh, wow. So it's really a great on-ramp for young people.
There is no other pathway in the American workforce economy where someone with a high school diploma and persistence and a desire to serve can make $100,000 within 4 years.
What's a paramedic do compared to an EMS technician?
Yeah. An EMT is literally 180 hours. It's like very much patch them up and get them to the hospital stuff. A paramedic is, so what we have what's called basic life support and advanced life support, BLS and ALS. And ALS means there's a paramedic on scene. And a paramedic is like 3,000 hours in training, more akin to a nurse than an EMT, which is basically an advanced first aid practitioner.
Okay.
Now they work together, but a paramedic takes significant training and a lot of field experience to qualify. And it's also an important pathway to fire. So this is really kind of important for folks who maybe don't know how EMS works. Fire is a foundational provider. About 80% of what fire services do nationally is 911 EMS. So if you're going to go into fire now, you are basically working in 911. So that's the kind of pathway. You pass the National Registry, you get your EMT, you go to work for a private ambulance company or maybe in a public EMS system, you earn your hours, you study to be a paramedic, you get into fire. There's a bunch of different on and off ramps there.
And the fire system in and of itself has pathways forward as well. So I'm really curious to hear what young people's experiences were as they participated in this program.
My heart is open to you for that question. And it's way better to hear it in their voice and story because I don't want to speak for them. And when I'm sad, I have a series of 3 and 5 minute interviews saved in my favorites.
Wow.
And I listen to young people talk about the transformation they went through, the changing of their life trajectory and their family's life trajectory. Like some of our early EMS Corps grads are now captains, lieutenants in fire services. And
awesome. What
makes the EMS Corps so amazing is that you only got to get the first 2 or 3 years, and then your graduates come back and become your skills instructors and your mentors. So we're
nice circle.
And I should state it, we are expanding EMS Corps to 14 new communities in America.
Did people just hear about it and call you, or were you purposeful in where you wanted to take it?
So any EMS system, if you read their plan, number one problem they will have on their plan is workforce. So I like to tell in Albuquerque, New Mexico, where half of our participants are from sovereign lands, which is amazing. A friend of ours became the child welfare director in New Mexico and was like, I got to have it, So that's how that one happened. But New Orleans, I love this story because a leader in the EMS system there, I think he's a captain. He was a teenager in New Orleans living on the fringes, and the hurricane came. And after the hurricane, they offered free training, and he just signed up to be a paramedic, worked his way up the EMS system. And he saw one of our videos of young people talking about their experience, and he called us and was like, we got to have it.
Yeah. And
so the New Orleans EMS Corps is starting in 2 weeks. And that's a great one because the young people become city employees from day one.
Wonderful.
So that's a great one. We started planning in Atlanta. There's 11 communities. At least I will say this just so it's not all roses and, peaches and roses. I'm a Medicaid guy. And I'm now learning how to be a workforce guy. Okay. And so I'm familiar with the complexity of public financing, and I thought Medicaid was messed up, and it is. Okay. Public workforce funding is somewhere in the equal dysfunction,
Well, just so for listeners, there're just all these very unique financing streams for things that don't always align with the reality of how anything practically works. And so while appropriations thinks that they are doing the right thing to say this is the money for this and this is the money for that, in reality, it's like in your budget. If you only got your salary, this is the money you can use for food and this is the money you can use for housing. None of us could manage our own budgets. We're forcing public systems to do the same thing. So I empathize with you
Yes. Yeah.
in that.
And I think that's some of the work, Lisa, we're doing with you and your team is thinking about this sort of nexus of public workforce, financing, and healing.
I want to ask what you've learned about, engaging young people, particularly those who have faced adversity as agents of change in their communities. I mean, here you've taken young people who could be described as, on the margins, really marginalized in their community and really made them essential workers in their community. What does that mean for them?
Yeah.
What's that mean for the way their communities see them and value them?
Yeah. In one of our early cohorts in Oakland, we had a poster up in the bus stop of Carl Bolts, one of our first graduates. On one side of the bus stop was a picture of him in jeans and a t-shirt saying, "Hey, my name is Carl. I'm not who you think I am." And on the other side of the bus stop was him in his EMT uniform saying, "I'm going to save your life."
Mm.
I think for those, again, I think anyone who has done this kind of work for a period of time, people are amazing. It is their birthright to heal and connect and live and improve and seek meaning and purpose. But we constrain those opportunities in low-income communities. And when you're hustling to make rent or get your kid food or off to school, like it's hard to see. And to your point earlier, when you provide that opportunity and see people recognize it and pursue it, it's intoxicating for all parties,
Yeah.
And to link it to Medicaid, the reason EMS Corps is so important to us is it tells this story in such a tangible way that people aren't a problem, they're the solution.
Mm.
That there's a beauty and wisdom and intelligence to lived experience that can be leveraged to the benefit of all of us.
It's very practical.
Yeah.
Very practical, very scalable. I mean, that's the beauty of what you've done is you have just talked about what we might want. You've created an infrastructure to do that. It makes me ask you the question of like, how are you training these young people? You talked about having a graduate come back to be an instructor, but what's the infrastructure that's needed to do this? I assume we were already training EMS technicians. Is there this is a little different than how you do that.
Yes.
How are you putting the
Yeah.
infrastructure together to scale this?
Yeah. What we say is every community already has everything they need to run EMS Corps.
Oh, good.
They have an EMS system who needs workers desperately.
Mhm.
They have amazing young people who don't even know this is a thing.
Right.
Rural kids and kids from the hood, they don't know EMS is EMS. They think it's the cops.
Mm-hmm.
You got to just teach them.
Right.
And they have community-based organizations that know how to support young people. And what we do is like peanut butter and chocolate. We bring them together.
Uh-huh.
And so our role is literally to go into a community and find the certified trainers, find the right CBOs, engage with the EMS system, put those people in a room, and man, it doesn't take much.
And you've already got a curriculum, what does this 6 months look like?
Yes.
Yeah.
Yeah. And we don't talk replication because it's not, it's unique to you.
Mhm. Because the community-based organizations are all different in the places where you're going. Uh-huh.
We learned some hard lessons. Like everyone wears a uniform. You come correct. You say a mantra. Like we have an approach. But when we come to a community, we're not like a franchise. We don't buy a building and drop staff in, right?
Uh-huh. You're building the local capacity.
The economic benefit of EMS Corps derives to that community. It's for those people, by those people, and it benefits them and one of the most important public services. Now, the cost issues are real. EMS Corps costs about $1 million a year, $900,000 a year for 2 cohorts of about 20 young people. Okay. So it works out to be 15 to 20 grand
per young person.
Per young person, which is roughly twice, if not more, than what most, employment and training programs. And we are uncompromising. That's what it costs.
Right. But it costs $100,000 to lock them up. So
yeah. Yeah.
And talk about persistence. Do most of the young people who enter the program, are they able to persist to graduation? Because you said they've got a job when they
Yeah.
graduate, so I don't
Yeah.
even have to ask about the hiring rate
No.
after they finish.
Yeah. We have 90+% graduation rate. We outperform the state
Fabulous.
average in passing the national registry. Um,
Fabulous.
Not every young person decides to stay in EMS.
Sure. It sounds hard. I mean, it's emotional, challenging work, but you've given them a start, even if they decide not to persist in it.
And there's obviously a reflective thing that happens. Like, we have trained you to save lives. You are now a lifesaver. And so young people have gone on to be firefighters. We have 4 physicians now, 10 years later.
Wow,
Yeah.
that's awesome.
It's pretty amazing. I mean, Lisa, as you think, I think you know, I'm like a policy person. I work with Medicaid and large systems. I don't like talk very often about individual programs, but this one's different.
You said it, I'm not a workforce person, but you darn sure have turned yourself into one. I'm curious what lessons you've learned that you've maybe shared with other workforce
Yeah.
programs so that they could have similar success.
Yeah, I think really strong and deep understanding of the systems you're trying to impact. You've very skillfully asked me about Medicaid and youth mental health and how it all fits together.
Mhm.
And a lot of my work is focused on how do emergency departments handle this influx of young people, and how do we expand access to services in schools, and how do we make managed care plans pay for services in schools. So, I do a lot of that. So when we were designing EMS Corps, we knew very intimately, because I was running the system, the challenges the EMS system was facing. And so I think there's understanding both the current reality of obviously who you're training people to work in, but also the needs of that system to evolve and improve.
Right.
You're not just providing cattle. You know what I mean?
These are people.
Yeah. Talent and to whatever future state you are aspiring to. So again, this is really important for the new provider types in Medicaid. Community health workers, doulas, wellness coaches, and peers. States across the country are doing it. As we think about integrating these new provider types, you have to bring some sophistication in the delivery system reform you envision.
Right.
Like, how does a community health worker work with an LCSW? Like, and what does that note look like? How do they keep their records? How does payment work so they both can cover their cost? So that would be my recommendation to sort of the workforce world, is dive deep in the operational policy and future state needs of the system you're serving.
And I think that's what's powerful about what you've done. Like, the innovation came from inside that system. It wasn't an outside workforce provider agency telling you what do you need and how can we build it for you. You were creative and thought about how can we do this differently? And innovation absolutely starts on the inside, but your deep commitment to trying to open doors of opportunity to new groups of people that you knew were going to be needed in this field also is an important part of that innovation. So I think those are important lessons for other workforce development programs to consider. Plus, things you said initially about how do you help people sustain themselves while they are in this transition? How do you help them resolve trauma or mental health challenges that are often barriers to people persisting and succeeding in new roles? All those supports and services people don't think about. They think I just need to provide the training and not think about the humans that they are trying to connect to it. Yeah, it's not workforce development, it's human development in lots of ways.
Amen.
Yeah.
That's very much it. Exactly.
Well, let's go a little bigger. Thank you for all of that insight into EMS Corps. But EMS Corps does tie into sort of broader Medicaid reforms that you've championed. I'm curious how this ties to that with things like making schools in-network providers and rethinking access to mental health services.
Yeah, I mean, at the risk of losing listeners who don't want to go down the Medicaid rabbit hole, Medicaid is a deeply troubled program, even though I love it and think it's sexy and essential to our future. But there's some changes that we need to make to it to unlock its potential.
To solve other problems, like you're solving an EMS problem. Talk about the other challenges we've got to solve.
Yeah. And states across the country are sort of waking up to these changes because they're all within their regulatory authority. Like, I'm about to give you a list of 5 things, but none of them haven't happened. Sorry, double negative, but they're all within the regulatory authority of a state Medicaid agency already. These have been pioneered in places as disparate as California and Georgia and New Mexico and New York, and none of these things are that revolutionary. But the first is we have to rethink access criteria and remove diagnosis as a prerequisite for care.
Say more about that for those of us who aren't in the medical field. You got to be diagnosed with something to get resources.
So here I am, a therapist in Oakland. In order to get paid, I have to give a kid a qualifying DSM-5 diagnosis.
You got to have depression. You got to be bipolar. You got to have a diagnosis, even though this child might be struggling for many, many reasons.
Yes.
They need a diagnosis to get help.
And I would argue that, like, of the hundreds of millions of dollars of services I provided, probably 20% of the kids I served were mentally ill. And 80% of the kids, something bad happened to them that they didn't choose. And,
but they still need mental health services.
Yeah. So I think we're coming to an understanding in our culture that kids didn't get twice as pathological, despite the fact that twice as many kids need help. Crisis care. Yeah. So this idea of rethinking qualifying criteria, and Dr. Nadine Burke-Harris and the ACEs work is really helpful there, right? Like, help us rethink that.
Right.
The second is this whole workforce bubble. Like, there aren't enough people anyway, so we've got to create new provider classes and make it easier for people to participate as providers. The third is we have to have a way for caregivers to get mental health when they take their babies to the doctor. So low-income people interact with the healthcare system the most frequently in the first 3 years of their child's life.
How can we use that as a platform to get people support they need?
But Medicaid only sees the kid as the patient.
How do we expand who it can serve? Right.
Yeah. You got to create a way for really amazing things like healthy steps or parent-child interaction therapy. It's kind of technical, but it's a big deal.
It's just saying, serve the whole family.
Yes.
Not just the child.
Yeah. It distills to letting a caregiver get a mental health service on their kid's ID. It's a technical trick, but a big, big one.
Gotcha.
The fourth is this idea that California just launched. It's not going well, but big things are slow, which makes schools the same as emergency departments in the eyes of managed care plans.
Wow. Say more about that.
Yeah, this is a big one. Children 8 to 18 use the health system the least.
Really?
But that's when like 75% of mental illness manifests. So everybody knows schools are the essential setting for a response at scale to the mental health crisis. And most kids in America now are covered by a health insurance plan with a mental health benefit. But for a school or a provider working in a school to sign up individually with all the plans is impossible. So what we did in California, and it's now lots of states are looking at it, is we leveraged something called portability, which means when you go on vacation, Lisa, your health plan still works if you need care in the emergency department, because all essential services must be paid for. So we made schools an essential provider. And it applies to Medi-Cal and commercial. And what it basically says is for a very defined set of services, any service delivered in a school is automatically in network for any managed care plan.
Wow. Right.
So it's a really big deal, and it'd be worth talking to you in a year about how it's working.
But it's a fundamental change in perspective that's already allowed that would enable millions of children literally to get the care that they need where they are.
Yeah. They all kind of work together though, right? Because even if you make schools automatically a network, but there's no new workers to provide the care, and then if you make them have a diagnosis before they need it, it's too late. So you kind of got to think of these as like the building blocks of systems change.
Yes. Okay. Great.
And you work them together. The final one is basically you got to be really creative with how you finance things. And I won't go into that on this call, but like there's tricks to Medicaid that help you get federal matching funds. And so you think about these 5 things together, and that's what states are looking at. And we're doing a lot of coaching and supporting and explaining.
That's awesome. But what you've really done is help our listeners understand what it takes to create system change. So often we talk about it and we say things need to run differently in order to help people at the scale where the need is. People don't always understand all the mechanisms to do that. And though they don't need to understand all of it, you help them appreciate that these little things about how the rules work that can unlock resources, can unlock workers, can unlock care for millions and millions of people. So while wonky, I appreciate it because I think it will help many people get what they need, and that's exactly what we want, and inspire innovation in other ways. Any final words of wisdom or inspiration to our listeners before we close?
I'd just like to maybe emphasize the last thing you said, which is you have to understand the systems you want to change.
Mm.
And so embrace the complexity of them. Don't be the person in the room that's always about your understanding, but don't quit until you understand it.
Mm.
Persist. You're smart. You can read. Dive into the detail and really unpack it, because you'll find all kind of opportunity for love and connection and healing.
That's wonderful. Well, thank you for every single thing you are doing to bring that vision to life, not just in California, but across the country. Thank you for everything you are doing.
Thank you for having me, Lisa.
And I want to thank all of our listeners for joining us on CaseyCast. If you liked our conversation, please recommend or rate us on your favorite podcasting app. To learn more about Casey and our guests, check out our show notes at aecf.org/podcast. Until next time, wishing all of America's kids and all of you a bright future.